All right. Welcome, everyone, to Dealmakers Table, the healthcare series. And today I have the pleasure to have Marshall Springs on the podcast. Marshall, thanks for joining us.
Yeah, thank you so much for having me, Blaine.
Marshall, what was really interesting is when we met previously, your journey from being on the Marine Corps, having managed and the privilege of working with an explosive detection dog handler, right, to joining and founding Combat Recovery Foundation is really impactful to the vets out there that need help and support. Um, could you share what ultimately led you to establish the foundation on September 11th, 2023, and what is the core mission?
Yeah, so after my military experience, like many veterans, I worked as a security consultant for almost 20 years. And while doing that, I had a business partner who was a Marine who very unexpectedly killed himself. And so it was that experience that led me to understanding more about the veteran suicide space and the lack of effective modalities that exist in that space. And so I started Combat Recovery Foundation to provide evidence-based effective suicide prevention modalities to veterans.
Oh, that's great. I mean, unfortunate, tragic event and catalyst, but obviously you're doing better things for a larger community now. So the Combat Recovery Foundation, does focus on preventing suicide for the vet population through what I understand is peer coaching, education, advocacy, fostering resilient communities. So how do those pillars directly address the unique challenges vets have in basically accessing mental health support?
Yeah, well, you've definitely done your homework, Blaine. So we've identified that veterans are really very terrible at showing up to get help, but they're great at showing up to help. And so what we've done is created a situation by which we offer veterans an opportunity to be back on mission so that they can experience purpose and belonging, which is the antithesis of isolation. And like any effective community, there needs to be a common mission. And so we get involved in serving the broader community. And when the veterans come together and they're working together to solve problems together, the help happens organically.
That's great. The theme today is really, rethinking. Um, I would probably say expanding patient support, right, in veteran healthcare. So, how are you rethinking that in terms of getting, some additional help and support? I know the traditional barriers, going to the VA hospital, maybe they have or they don't have the support that they need. I know you offer some unique, different alternatives, right? You said that we mentioned before. Um, how are you rethinking that approach? You mentioned a couple of them earlier, but are there other ways that you're reaching out to expand the patient population that you can help serve?
So I think a couple of big differentiators that we've created here at Combat Recovery Foundation is that this is created by veterans and for veterans. And so that makes it really easy. The litmus test for whether or not something is effective is whether or not it would work for us. And then, that makes it a really easy thing for us to then suss out whether or not it's something worth pursuing. And so we have created a non-hierarchical system here where it's not a person with a degree telling a person how they should live their lives. It's people who have survived the very same thing that that person is struggling with, simply illuminating how they survived it and maybe asking questions around how the person across from the table can apply the same modalities to the barriers in their life.
Yeah, so it's a relatable experience then for someone talking to a peer who's experienced the same thing. A great approach for sure. When we talked, you mentioned that everyone's suffering from an allergic reaction to the isolation, and it seemed to affect veterans more. How does fostering those resilient communities and engaging the veterans in the common ways that you talked about serve to help, basically expand your outreach and keep those folks engaged with the communities that you're trying to help?
So, suicide has been inaccurately identified as a mental health issue, and resultingly been the problem has been usurped by the mental health industry. And it's our observation that suicide is not in a condition that affects a small percentage of people who have some large undegree checked of or unchecked mental illness issue. The issue is that we are, all of us, as you said, struggling with an allergic reaction to isolation. The veterans, because of having been a part of a community and having been a part of having experienced that brotherhood and that camaraderie and being a part of a common mission, when they transition out of the military into their civilian experience, they're thrust into an environment where all of that purpose and belonging and camaraderie, brotherhood, all of that common mission just goes away entirely. And we live naturally in a very competitive environment, and that's not how our species has developed or has been successful or survived up to this point. And so it's kind of giving us all, a little bit of an emotional whiplash to to traverse this quick change into the modern human. We come from tribes of between 8 and 80, and now, we live in a tribe of 8 billion, and information used to move at the speed of a carrier pigeon, and now it moves at the speed of light. And so we're not equipped as a species to live in the environment that we have built for ourselves. And so we need to buttress that environment with modalities and methodologies that are they're they're old in terms of they've existed within our species for eons, for as long as we've been here. And so reintroducing those conditions to our daily lives is reinvigorating people's desire to show up and be alive and be a part of the solution.
Shifting gears, we talked about, some of the challenges and some of your innovative solutions that you've found for the foundation. It's my understanding that you don't accept any government grants or tax dollars. You're primarily relying on brand collaborations and other, sources of funding. So how does that unique funding model impact your operational strategies and your ability to scale to reach more veterans?
So I started working in suicide prevention in 2019. And when I did that, I worked for another nonprofit. There were 13 people who worked there. One person prevented suicide, and that was me. And the other 12 wrote grants, planned fundraisers, and did grant compliance. And I felt like that was a huge waste of resources. And so when we started Combat Recovery Foundation, I wanted every single person involved in the organization, part of their responsibility is to focus on developing programming and meeting the veteran where they are and assuring that we're in alignment with completing our mission. And so we've created a fundraising structure that requires a lot less staff hours to maintain. And we're also not relying on the goodwill and compassion of the community. We've created a mutually beneficial fundraising model to where I'm not asking business owners for a donation off their bottom line. I'm looking to add to their top line and just take our fair share. So what we have done is we approach businesses that produce a product, and they create a line of that product that bears our logo. We help them market it, and then they give us a donation of the portion of the proceeds of that product. And so an example of that would be there's a coffee roaster here in Northern Colorado, and they're called Wander Coffee. It's owned by two brothers. They do an exceptional job of making coffee. They're very ethical in terms of the farmers that they choose to work with and the processes that they implement. And so they've created a unique product line called Rising Phoenix Roast. And when you purchase that coffee from them, they're going to donate 10% of the proceeds to the nonprofit. And so we've got Wander Coffee, we've got Colorful Colorado Creations makes a hot sauce. We've got Nuance Chocolate is making a chocolate bar for us, and the chocolate bar is pretty fun. They're actually using the Wander coffee to
Oh,
make
wow.
a coffee chocolate bar. And so there's a little bit of cross promotion going on there. And then we've got a really exciting product coming out with Sweetheart Winery where they're creating our own cider line called Patriot Press. And so that's going to be multiple flavors in that line. It's going to be in over 100 stores by the end of the month. And again, a portion of those proceeds benefit the nonprofit. So the business is doing what they do. We're focused on mission, preventing suicide, serving the veterans. And in the background, this mechanism that we've set up is working to provide both the business and the nonprofit with the resources that they need to thrive.
It's great. What an innovative and unique way to go about, funding, the tremendous work that you and the team are doing. Fantastic job. So that's, some of the really good opportunities that you have to keep the business running, keep the mission going. But I also understand that there's some opportunities that need to be addressed, right? You mentioned, having some frustrations with some government bureaucracy. You tried to do a 5K event, which was essentially squashed. You also have some other property in which people could potentially leverage and use a school system, a school, I believe. How did these government hurdles directly impede your ability to acquire and basically serve more veterans? And what lessons learned can be drawn upon those for the broader system, or what messages should be given to those agencies so that missions like yours could serve more veterans?
It gets frustrating when I sit down at a meeting with Larimer County, which is where we're located, and they'll all be scratching their heads and pretending to be very compassionate about the problem and wondering, well, why in the world are veterans killing themselves at the rate that they are, and what can we do about it? And then in the next breath, they'll disallow us access to, a property where we want to do an event that would directly contribute to preventing that suicide. And so what you're referring to is we have access to approximately 1,000 acres close to town here. And on that land, there's river access and fishing ponds, and it's a 3 mile track around the valley, and so we were going to do a 5K there, but the county their compliance needs are so onerous that it's rendered it impossible for us to do events like that. And what's more, they're actually making it difficult for us to access or utilize the land in the first place. And I meet with other veteran serving nonprofits who are dealing with a lot of the very same frustrations to the point that it's making them look outside of the county for a home for their programming. And Larimer County has got one of the fastest growing veteran populations in the country. And so, as long as the county is making it near impossible for veteran serving organizations to access and serve that population, they are creating an underserved population within their own borders. And then, I don't know, again, scratching their heads and wondering why the problem exists in the first place. Well, it's the problem that they're causing.
Right. Kind of moving into, the future and the broader healthcare landscape and being able to serve more veterans, considering your experience and some key lessons learned, that traditional VA hospitals or systems could learn from you and your team and the mission that you guys are undertaking. How does the community, based peer-led approach lead to engaging and supporting those individuals? What are maybe some of your lessons learned that should be applied more universally across these healthcare systems serving the vet population?
There seems to be a pervasive concept that you can learn everything you need to do to learn about a group of people in a university setting. And what I've witnessed from people who have degrees is that they come out of that college experience with a great deal of hostility and anger, and I'll say, borderline bigotry. And it creates a lot of barriers to communication, and that again, that hierarchical system of, well, I've studied you, and therefore I know more about your lived experience than you do. That creates a fundamental breakdown between the patient and the doctor.
Yeah, I can certainly understand that. No one wants to deal with a know-it-all, right? So, looking at the biggest opportunities that you have for improving, veteran mental health support in the next 6 to 12 months, how is the Combat Recovery Foundation positioning itself to capitalize on those opportunities to expand your outreach, obviously, expand probably your funding sources so that you can achieve more and support more veterans. What does that look like to you in the next 6 to 12 months?
So what I like about Combat Recovery Foundation is we've created, for lack of a better word, an incubator for veterans to create their own solutions. And so what that looks like is if a veteran comes to a meeting with us and they're passionate about a certain type of activity, like if it's let's take, kayak fishing, for instance, because we just recently met with a person who does that. So Combat Recovery Foundation isn't going to go find a fishing guide and a bunch of kayaks and then put together, the participants and have them sign the waivers and the onboarding opinion sheets and the offboarding sheets and all of the data gathering and everything else, and then facilitate this kayaking experience. What we're going to do is we're going to take that person, we're going to say, all right, you want to do fishing, kayaking. What do you need to make that happen so that you can bring that modality to our population? So we're empowering the veterans to create their own solutions, not administering solutions for them.
Right. Well, if I get to northern Colorado again, which I lived there for about 7 years, I'll be maybe contacting because I love kayak fishing myself. So that'd be fantastic.
Awesome. Look us up. We're always doing some kind of a crazy adventure up here.
Absolutely. Well, kind of wrapping things up, Marshall, for healthcare leaders, who are really looking to rethink their support of vets and their strategies, especially for the underserved or vulnerable populations. What's one piece of advice you would offer them based upon your work with the vets you serve?
I think it's to understand that if you're dealing with a veteran, that's a person who at one point they signed their name on the dotted line to put their life on the line for strangers. And that's a person who as deeply as their feelings go, want to serve, be relevant, and help and be part of the solution. And so empowering them and enabling them to solve problems that exist at the community level is the best way of getting them invested in showing up day in and day out, is giving them a reason to be there.
Well, so just to make sure that people know how to contact you, maybe if you could give some contact information, website addresses, so that the individuals listening to the podcast can reach out. Um, would you let us know how they can, make sure that they get the community and the outreach that would help them?
So unfortunately, CRF was taken by the Cardiac Research Foundation. So we had to go ahead and utilize our full name in the URL. So forgive me for this, but you can reach us at combatrecoveryfoundation.org. And you can also find us on all major social medias.
Right. Well, Marshall, thank you so much for coming on the podcast and really greatly appreciate the mission that you and the team have there at Combat Recovery Foundations. It is a very much underserved area, and do appreciate everything that you're doing for our vets who really do need the help, support, and community that you guys offer.
Thanks for having me on, Blaine, and thanks for letting me talk to your audience.
Absolutely. Have a great day, everyone.
Same to you.